Yes, I do think it's important for us to get back to physiotherapy. You know, we know it's really important for people who are recovering from those surgeries that are going to start again, for example. So yes, we know that there's dental procedures that need to happen, but we need to do it in the context that recognizes that we are at risk as a community and we are at risk individually in our practice. So yes, we need to look at not having everybody sitting in the waiting room at the same time. So it may mean that we have people coming in at set appointments. We may not be able to see as many people in a day, but we have to do it in a way that we have the appropriate protections in place. We have hand hygiene available. We have separation for the reception staff, for example, for people sitting in a waiting area, making sure that we can have this, minimize the number of people. So it's going to take differences in our flow through and how we do that. And we were looking at, and it's going to take us to be very vigilant about our staff and about us if we're feeling unwell at all to stay home. And also we need to understand the impacts in the community if we start to allow other things to happen as well. So if I'm working in a higher risk environment, like in a dental office or a physiotherapist, then I need to still be vigilant at home that I'm not having lots of other connections, because I'm more likely to get sick and more likely to bring it into my practice or bring it back into my family life. So those are all the things that we need to start thinking about, where we can find that balance where we increase what we're doing, but it's not going to be right away back to what it was before, when we have lots of people sitting together for periods of time and then we have close contact with them. So I think those are some really good things to think about. How do I make sure that we don't have, you know, all the workers coming in sick and not recognizing it, and you know, a couple of outbreaks that we've had recently have expanded because people have not paid attention to even having mild illness, and that presenteeism that we have. And I know it's very strong in healthcare that we feel like we need to be there because people are depending on us. We need to be really careful about that for the next year, and that cannot change. We need to have that being able to stay away from others if we're sick, being able to clean our hands regularly, being able to maintain safe distances, putting in barriers that protect us from spreading our droplets to others. And that may be a mask, that may be physical barriers like a plexiglass.